Please subscribe to Quantum Calhoun Transition channel and order my book Naturally Conceived through Amazon. Thank you for watching. Hello everyone, Fertility Empowerment Show. We are alive, we are happy even during this pandemic. We are thriving and we have a beautiful guest today. Her name is Aleksandra Vujnovic, Doctor of Chiropractic. And we're gonna talk about how we may enhance the fertility health for couples. Especially, we're gonna find a relationship between the chiropractic and fertility. Welcome to my show, Aleksandra.
Thank you so much, Pantea. It's wonderful to be here. Hello, everybody.
All right, tell me about yourself first, and tell me how did you end up doing what you're doing right now, and how you can help your patients.
Absolutely. How did I end up here? Well, I have a chemistry degree from Chapel Hill. So I always was fascinated with how the body works, and specifically the things that we really have no control over, right? Just like we don't really think about the food that we might have ate this morning, right? We don't think about taking a breath while I'm speaking with you, or doing any of these autonomic functions that sustain life, right? So being in the chemistry field prior to this, I was just fascinated by the way the body works, right? So I worked for a medical device manufacturer for a while, and then fortunately they closed, and I was like, what is Alex going to do moving forward? So I love working with my hands, and I always knew that I wanted to serve people. And so I did some Google searches, and I literally typed in hands and service, and chiropractic came up amongst few other things. And as I did my research, and I noticed that chiropractic focuses on the balance and the integrity and the function of the nervous system, and hence that is what controls every single biochemical reaction in the body, I felt like this is meant to be. So I did some research on Sherman College of Chiropractic, and I was absolutely 100% sold. I was like, this is what I want to do. And so in school, my brother and I became a father for the first time. I became an aunt for the first time, and something in me switched, and the concentration on pregnancy and children care just like instantaneously came about. Like that maternal instinct woke up in me. And so allowing me to prepare myself for the journey of parenthood, I think, is the reason why I gravitated towards the preconception work and working with children in my practice.
Beautiful. So you see, that's destiny. Because you see something, then something in you is giggling, and you say, oh, I have to do this, I have to do this. Yeah.
Absolutely.
Yeah.
Absolutely.
And I'm just wondering how chiropractic can help pregnancy.
So let's talk a little bit about what compromises health. And so when we are under stress, and we have stress in three shapes, we have it in physical, emotional, and chemical. When there is too much of that, and we are not able to properly adapt to that, which is the function of your nervous system, it puts us into what we call autonomic dysfunction. It puts us into what we call sympathetic dominance, which is fight or flight, during which time the body doesn't really want to talk about or think about reproduction, because reproduction is a function that the body is more likely to go through if it's in the rest and digest form of the nervous system. It requires you to be safe. It requires you to be at rest. It requires you to be in pleasure. But when you are in sympathetic dominance, you are under threat. So you're not going to think about procreation. And that's a safety mechanism that the body has to protect us. Because when you're under stress, you don't have the capacity or the mental strength to really take care of a newborn.
Yes, exactly. Because your body needs to create something, and creation happens when you are not feeling unsafe and you actually have a lot of excitement to do something new out of yourself, right? If you are
Absolutely.
distressed and unhappy, you're not going to be in the creation mode.
Absolutely, absolutely. I mean, the process of an egg and a sperm coming together, it's something you don't think about, right? It's a coordination that happens as a result of our autonomic nervous system. So taking care of the function of your autonomic nervous system, which is what a chiropractor does through adjustment of the spine, we can optimize that function. And so hopefully, while normalizing the stability of your nervous system, we can enhance somebody's outcomes of natural conception.
Mm. So do you have, first of all, how long have you been doing this?
So I have been in practice for 2 years. Like I said, I have a bachelor's in chemistry. And then after that, I have 4 years of postdoctorate training. And then I've been in practice for 2 years.
All right. And did you start right with the pregnancy patients, or you have other patients?
So I see variety of patients. I see families. I see individuals. I see really everybody. But my focus, which is what I do continuous education on, and which is where I really do a lot of continuous education on, and my mentors are in, is in brain development as well as trimester 0 or preconception health. How do we ensure that the mom and dad can create the right health prior to entering into the game of conception?
So give us some example. How can we prepare ourselves?
Absolutely. So again, one of the things that one of my mentors who has done the work for us, she has practiced over 11 years now, and her sole practice is based on this, right? She has done all the research for us. So she has created a blueprint on how do we bring this to our communities as well, and how do we spread this message all over the world, right? So one of the things that we have in that she has discovered is the primary thing that might impact somebody's ability to naturally conceive is what we call insulin resistance. So if we have potential dysregulation in the way we are responding to our insulin in the body, it could potentially impact all other functions in the body. Okay. So what she has done is she actually has created this beautiful protocol that concentrates on number of pillars in order to restore health. And the way we approach restoration of health through a holistic or chiropractic office, chiropractic lens, is through what we call a salutogenic model of health, which salutogenesis truly means birth of health. What are the habits one needs to practice in order to create health? So the first, of course, is going to be chiropractic care, getting the function of the nervous system optimized. The other part of that is going to be proper movement, right? Are we properly engaging in movement? The next part of that is going to be hydration. Do you have enough hydration in the body? Because believe it or not, the process of sperm and egg coming together needs to have enough hydration in order for that process to take place, right? And then we talk a lot about empowerment. One of the quotes that I love from Dr. Young is this one. I'm going to read it to you guys. A mind in love releases very healthy chemicals such as dopamine, vasopressin, oxytocin, and growth hormones, all of which increase oxygenation and pH, right? Oxygenation meaning it increases the function of your brain, and the pH meaning that it allows the body to go into what we call an alkaline state, which decreases disease processes and optimizes the function of the body. Which one of those functions is reproduction?
Yeah, I like this alkaline point because that's what I always tell my clients. You need to get rid of acidity, too much inflammation that the food actually creates for you is part of that.
Absolutely. So how
Yes.
do we bring alkaline state into the body? One of them is eating real food, which is, I always tell my patients, when you walk into the grocery store, stay on the outside of the aisles, right? On the outside perimeter of the store. You want to have proper hydration and you want to be moving, because movement, and I don't just mean routinized gym activity, I mean movement, playing with your children on the floor, or chasing your puppy if you have that right now, or just strolling down the street and just observing the environment, right? Paying attention to your surroundings is another way to increase movement.
Simple walking, Alexandra. Simple
What was,
walking. I
I'm
said
sorry?
constant walking.
Absolutely. Walking is one
Yeah,
of the best exercises.
exactly. You don't need to be very complicated. I remember during my pregnancy, I always walked.
It
Yeah,
prepares you for delivery as
exactly.
well.
And yeah, I had a
Absolutely.
very, very easy delivery, so
Mm-hmm.
I know how it works. Like if you go to doctors, chiropractors, all of them recommend not to do a very heavy exercise, even in preconception, because any moment you may be pregnant. So you should actually uh, stay away from very heavy exercise. But some of these exercise, like walking or doing some stretches, these are
Absolutely.
great. Yeah, and you need to keep
Absolutely.
moving. Yeah, exactly.
Absolutely. So one of the things that in salutogenic model of health, we don't look at pregnancy. Conventionally, pregnancy is looked at as 9-month disease, right? We have something that we have to push out and we have to manage. Well, in a salutogenic model of health, a pregnancy is a side effect or an effect of a healthy body, right? Only healthy body can go through pregnancy. And so when we hear a lot of people complain about, they're having nausea during their pregnancy, they are having gestational diabetes during their pregnancy, the first thing that we really want to ask ourselves, well, how healthy is that person if those are the symptoms that are coming about during this time? And so with my mentor who established this protocol, she currently has 165 babies who have been born with this protocol. Not a single couple who has gone through this protocol has had gestational diabetes during pregnancy, has had hypertension, has had gallbladder removal, which is one of the basic surgeries that most pregnant women will go in for as a surgery. So this protocol has been proven, and it is building health for couples that are wanting to be proactive and create health for them and also pass that on to their children. What's interesting is children also don't have any lip ties, tongue ties. They don't have any colic. They don't have any ear aches. So imagine that being our future if we were to all do something like this, a trimester 0 health.
So how can we prevent nausea?
So again, it has a lot to do with
because I had it all. You can't believe it, from the beginning until the day of the delivery.
I get that it's a very common finding, but it is something that can be, again, it might be something along the lines of depletion. Again, I understand that maybe some of the foods may not have really sat well with you, or we also know that sometimes nausea. Do you hear me well?
Yes, perfectly.
Awesome. Sometimes we know that the nausea has a lot to do with the quality of the partner's health. So remember, placenta is something that is derived by the sperm. And so technically it is something that is a foreign for the mom. So if that is not as healthy, mom can be expressing that unhealth through the nausea, increased nausea.
You know, I like that because everybody thinks that that's the only mother should be healthy before pregnancy. That's the wrong opinion, right?
So you are absolutely. It is a very common, and we find it very much in the conventional approach. Any problems with fertility nowadays are approached as this is the female who has to go through X, Y, and Z, and then hopefully will get pregnant. This protocol was designed because pregnancy is a tango dance that requires two, right? So when we are encountering challenges in getting pregnant, we want to involve both partners in optimization of health. And so what we know, again, is a lot of miscarriages are due to placenta, I'll call it lack of strength, because the sperm is not in the health quality that it needs to be in order for the pregnancy to go to term.
Yes, because every time women think that they are the problem, and men eat whatever they want. But that's exactly, I'm just confirming your words. Yes, that's correct, because in the beginning it really needs to be considered, men and women. But during the pregnancy, then you cannot do anything about it. It's already there, and you have to take care of yourself, even if you have that with you.
Absolutely. So what I love about that, again, is regardless of the outcome, I think this protocol allows for compassion for the two partners to truly discover, why did we decide to say I do? Because most of us, I am hoping, don't just get married to create children, right? We actually like something about our partner that drew us to them and that we want to nurture for the rest of our lives, right? So I think this protocol also allows us to create that forgotten compassion that I think will eliminate the 50% divorce rate that goes with these couples who are currently having challenges in, right, with fertility issues. So I think from that perspective, it's so important that we recognize, why did we say I do? And then when we think about the I do, how long did we take in preparation before the one day of wedding, right? It took us a year, maybe even two, to prepare, to decide what our dress is going to look like, what our mom is going to wear, what our hairstyle is going to be like, right? What the flowers are going to look like. Well, if we put that much effort into one day, I think we owe it to ourselves to put a little more effort into the marathon of carrying a baby for 9 months and actually doing something prior to that dance so that we can optimize the actual experience during the pregnancy, but also postpartum.
Yes. You know, that's exactly right. Because I'm just telling you the truth about the having the baby. Please enjoy being together and enjoy your privacy before having the baby. So I am saying there's a trimester 0, which is you're preparing. It should be the most enjoyable time together, because after that you're not gonna be 2, you're gonna be 3, or maybe later more, and you may not have the same privacy anymore. You may not have the same sleep quality anymore. Your house is not going to be organized the way it was before having the baby. So it's better you enjoy time in trimester, in 0 trimester.
Absolutely. I mean, things are obviously going to change, right? But those changes bring about pleasures and new challenges and new awareness, and it transforms us into the beings that we're supposed to become. For me, I think pregnancy and delivery, had you asked me this 5 years ago, I would not have had the same answer for you. But because of my training and because of what I've learned about the body, I think delivery and pregnancy is something that transforms a woman into a woman she's to become. And so, irrespective of you going through that process, there are many ways you can become a mother, and there are many ways you can nurture somebody. So you can always go through that step if you allow yourself to go through it in the manner that it's designed for you to experience that. So not everybody has to have their own biological child to experience the joy of motherhood, to experience the things that can transform that identity for you. And I think sometimes we don't give ourselves enough compassion for that, because again, the society tells us, women, you're not worth it unless you are a mother, right? And God forbid you cannot conceive on your own, you are a failure altogether. So I think that's just something as a doctor, I would love to break, and I would love to support women that needs to be far, far, far from your mind, because it's so false.
Exactly.
And it's destroying our beautiful kind. It's destroying our women for no reason.
Yeah, because that's what I always tell my clients. Enjoy yourself, take care of yourself, just as individual, as a woman, even before having any kids.
Absolutely.
Because maybe women think that they are not perfect enough when they cannot conceive, and this is a blocker. Even it blocks their natural way of having the baby.
Absolutely. And then again, what we know is conventional medicine will make you believe that it's your sole responsibility to fix this issue. And quite frankly, it may not even be an issue. It's just maybe that you are having problem with the hormone balance, you're insulin resistant, and we just need to, again, till the soil, make sure you're healthy. But what we find is that most males, 50% of the fertility issues are male related. So how can you fix it if you're only concentrating on the wrong part, right? So again, it takes two to tango, and it will take two to overcome this challenge as well. And that's what I love about this program. It is designed for you guys as a couple to go to travel this journey that will first
Together.
create together, absolutely, that will allow you to become closer together, will allow you to discover what's really important to you, and then along the way you're bringing somebody else into this world that you'll know how to actually appreciate.
Beautiful. So this is your website,
Yes.
Greens, uh, greensborochiropractor.com.
Yep.
And that's your Facebook, greensborochiropractor.com.alex.
Yep.
Tell me about your website and your program first.
About my website. My
Yes.
website currently only talks about pregnancy and optimizing pregnancy and birthing outcomes through, again, optimizing the function of the nervous system. I don't really yet talk about this program on my website as much. So I love the opportunity that you, Pantea, have given me to kind of jumpstart this conversation about what I can offer to my community, as well as wider audiences. But if you would like to chat with me in regards to this, please just fill out the connect form with me, contact us form, and I would be happy to reach out to you and set up a virtual conversation just like this to figure out what are your goals and how we can get you to where you'd like to go. And if I am not able to do that, then I can find people, because I have the resources that will put you in the right hands to travel this journey alongside with you.
Yeah, thank you so much. This is just showing them that they are not alone in this journey, because going alone in this journey, especially during this pandemic, is so difficult.
It's a challenge.
Yeah,
Yes.
there is
And
always
you're never
support.
alone.
Yeah, there is always support there. And if you have some issues in your fertility, don't think that you should take the medication, and you're losing if you don't take it. But there are other holistic medicine practitioners there, and there are other diet and other solutions that you can get some help from it, and then do your medical procedure.
Absolutely. Absolutely.
Okay.
Thank you so much. Thank you, guys. If you have any questions, please don't hesitate to reach out. You have the way to get in touch with me through my website, and I look forward to meeting you and serving you in any capacity that works well for you. So thank you, Pantea, for this opportunity,
Thank you so much.
and it has been a pleasure.
Yeah, thank you so much.